Hello, I'm Juju Chang, and this is 2020 In Touch. It's one of the hot-button issues in this presidential campaign, what to do about health care in America. John Stossel has been looking into that crucial question for 2020.
Braden Weirs works for Whole Foods. 5 years ago, the grocery chain switched to a different kind of health insurance, a policy that puts patients more in control.
Because it's like, at last, I can go to that acupuncturist. At last, I can spend the money the way I want to spend it.
It's an insurance policy with a high deductible. That means Braden must pay about $1,000 himself before his insurance kicks in. If he gets cancer or heart disease, his insurance covers it. But if he has a sore throat or a sprained ankle, he pays. To help workers pay, Whole Foods puts money into an account for them. Braden got $1,500 this year. If he doesn't spend it on medical care this year, he keeps it, and the company adds more next year.
And I have plenty of money left over so I can go get my new prescription glasses at the end of the year.
HSA puts you in control.
Most companies call these accounts HSAs, health savings accounts, or health reimbursement accounts.
So you try this new system, and what happened?
Our cost went way down.
Our CEO, John Mackey.
Today, some workers have $8,000 in their health accounts.
And then that's their money, and it builds up over time. And so that's great because the money is compounding for them.
I can save up my money and afford to have a child later on.
He controls the money, and as the money builds up, it can cover all sorts of future out-of-pocket expenses.
And it changed behavior.
They start asking how much things cost. They begin to ask questions. They may not want to go to the emergency room if they wake up with a hangnail in the middle of the night. They may schedule an appointment now.
They didn't ask what things cost before.
Why should they? Somebody else is paying for it.
Thank you so much.
When she went to the doctor, marketing director Marianne Buttrose never used to ask.
Well, how much will this cost? Because it didn't matter. And I'll get someone to help. And now it matters to me because it's my money. It's my money.
Maybe they economize by not getting health care that they need.
The premise in those kind of questions, John, are that people are stupid. They're not smart enough to make these decisions for themselves. It's sort of an elitist attitude. The individual is the best judge of what's right for the individual.
And apparently, most individuals are making smart choices.
People who have these high deductible health insurance policy take a lot better care of themselves. They'd have more yearly physicals because they're saying if I keep myself healthy, in the long run, I'm going to be spending less money.
Sherilyn Schmidt used her account when she wanted to get a physical. Since it was her money, she shopped around. She found prices varied by hundreds of dollars.
If I had regular insurance, I would have never called around and asked for prices. I would have just walked in, showed my card, said I need a physical, and they would have given me a physical. And I don't even really know what they would have given me because I would walk in and say I need a physical, and they would say, okay, well, this is what a physical entails, done.
And the fact that she was paying changed the way she thought about that physical.
I started thinking, well, what am I getting for this price? For $1,200, what am I getting?
I hear some doctors are saying, gee, nobody's ever asked me that before.
Yeah, and they don't often know. I mean, that shows you how dysfunctional our healthcare system is, that people don't have the vaguest idea how much they're spending on healthcare, close to the closest $10,000 or $20,000 often when they go to the hospital. And the sellers don't have any idea what it costs.
We know what HEB is selling broccoli for right now, so we have to reflect our prices to the competition. But in healthcare, no one's trying to think, yeah, I'm going to cut 5% below that price so I can increase my business.
John Mackey says this competition will improve health care, except so far, not enough people shop for it.
The doctor doesn't feel compelled to compete on price. The doctor doesn't worry that he's going to lose that business to a competitor down the street. So there really isn't any price competition going on.
That's why he says despite their big initial savings, Whole Foods healthcare costs are creeping up again.
But if everybody was out there asking doctors what things cost, if doctors were advertising their prices, we'd begin to see prices dropping.
I'm Juju Chang. For all of us at 2020, we're in touch, so you be in touch.